Health and social care research is the process of testing new diagnostics, treatments, approaches and services to generate new knowledge with the ultimate aim of improving health and social care outcomes for patients and service users. It's very important that people come forward to participate in research, and it's also a very sound investment for health and social care funds. CHITIN is Cross-Border Healthcare Intervention Trials in Ireland Network. The acronym is significant because chitin is a substance that forms the exoskeleton or the hard outer shell of an insect, creating a network that holds the body of the insect together, and I thought that was significant, that we were creating a network of health and social care research professionals. The chitin trials, there are 11 trials funded, so ourselves and our partners HRB will give the money away to researchers to carry out trials in areas such as asthma, diabetes, mental health and stroke, and across age groups from children right through adults to older people. And they'll take place in primary care, community, public health, and will involve a massive number of different health and social care professions. Many trials would take place in major centres such as Belfast or Dublin or Galway, and less so would take place in more rural areas or more remote areas in community or primary care. So we are hoping that the CHITIN Project will create more capacity in these areas that will be able to then carry out this type of research into the future. Ourselves and our partners HRB have been long-term funders of health and social care research and have worked together in partnership over many years.
The role of the HRB is to use research to improve people's health, to improve the delivery of healthcare and health services, and to inform decision making in health. Over the past decade or so, we've invested a lot of resources in infrastructure to support clinical trials in Ireland. And the reason we've done that is that we know that getting involved in trials and in clinical research improves patient outcomes. The opportunity here we have with CHITIN is to try and rebalance some of that and to bring some of those benefits of clinical research and clinical trials to the community.
There can't be too many people who haven't been touched during their lives by something that has been created from research. And I've been lucky enough to actually see some treatments that were being tested whilst I was studying at university that were now being offered as treatments to my own father, which allowed him to have 10 more extra years of healthy life.
My condition is mucopolysaccharidosis. It's MPS for short. It's extremely aggressive bone wastage disease. When I heard there was a possibility of a trial, I thought, you know, it's time to try something, because never any good news. So to me, this was like something positive that you've never had before living with a condition like this. So we jumped at the chance to get onto the research trial. It was a struggle at the start because I was in such a poor health condition, but as I was going, because I was getting the drug, I was getting stronger and fitter and healthier, and I was starting to lose, you know, like my walking aids and things like that there that I was on. So it made a massive improvement. Being part of a clinical trial or clinical research has just changed my life massively, so it has. Before, I never went anywhere, done anything before, you know, I was always sort of housebound before that. Being able to travel and do different things with just being on a clinical trial, because it's given me hope.
Well, when I was diagnosed with relapsing remitting MS in 2010, it just came as a complete shock. Didn't know what multiple sclerosis was. One of the first questions I wanted to know was, is there a treatment for MS? Can it be cured? And the answer sadly was no. A lot of the reasons why people actually participate in clinical trials is because they don't want what happened to them to happen to anybody else. I really felt that if medical research is going to progress and if I could play a part in it, that it was very important for me to take part in a clinical trial, because, like I said, I don't want this to happen to anybody else in the future. Participating in a trial is so important because how else do new medications or cures actually get to market? You need people to participate in clinical trials. My MRIs for the last few years have shown no evidence of disease activity, which means really the drug has stopped my multiple sclerosis progressing. What was there is still there, but there's no progression, which I'm really very grateful for. And it means that now I can get back to the workforce and enjoy my family life. Just really makes a huge difference to my life that I'm on the drug that I am. And every time that a clinical trial happens, we learn more, we find more out. So that's the hope, that in the future there will be better treatments and hopefully a cure found.
The legacy that we're aiming to leave behind from the CHITIN Project is twofold. Firstly, we want to create a network, as the project says, of health and social care professionals who are trained in research. And so we hope in the future that those researchers will be able to be part of trials or even bring trials to the area themselves, which will bring us to the second aim, which is to provide opportunities for citizens in Northern Ireland and the border counties to participate in health and social care research and enjoy the benefits that that can bring them into the future.